Hello everybody, I am Dr. Paromita Kanjilal Chakraborty. I am a consultant in emergency medicine at Manipal Hospitals, Salt Lake, Kolkata. We would be talking a little about disease surveillance. Now, what does disease surveillance mean? It is basically an information-based activity where a large number of data is systematically collected, it is analyzed and interpreted so that we can provide public health intelligence to the relevant authorities so that we can monitor disease trends and take public health action to improve the health of the community or the individual per se. Now, why do we say that surveillance is important in the emergency department is because the emergency department forms an interface between the community and the healthcare system. So it's kind of the front line between the community and the healthcare system. There's a huge volume of demographic data available in the emergency. There's a huge volume of case mix that comes to the emergency department across the world in various hospitals. Now, if we can use this data to see the disease trend, like which disease is more in which season, if we can identify a trend, let's say for example gastroenteritis, we see that there are bouts of gastroenteritis during spring, or we see that there are bouts of dengue fever after the monsoon, so when rainwater starts collecting. So this helps us to find out which community is at risk, what are the interventions that one might do or the public health authorities might do to prevent this disease from spreading across the community or causing unusually large numbers of the disease. This initially was done only in infectious diseases. So, to find out cases of chickenpox, influenza, etc. Now this concept is being slowly extrapolated into various other things. One of the most important things that we are now dealing with is injuries. So most developed countries would have something called a trauma registry, where the demographics of the person coming to the emergency department with any sort of trauma is recorded electronically, and you collect information about the age, the gender, what mode of trauma is common in your emergency department, what are the effects of the trauma. So once you get to have that data and you have a central server where you can incorporate all the data coming from the various emergency departments in that particular jurisdictional area, you would know that you might be having more of two-wheeler traumas, or you might be having more of traumas to people not wearing a helmet. This helps the health department or the public health authority to incorporate laws like making wearing of a helmet on a two-wheeler mandatory. So we say that prevention is better than cure. If we can find out what are the risk factors, what is the common population that is being affected by a particular disease, the health authorities might take action, might form plans to prevent this particular disease, injury from affecting large number of the community. Personal experience that we have seen recently is when we were handling a lot of COVID patients, we saw that if we could incorporate the data that is available from say 5 or 6 hospitals in a radius of say maybe 5-10 kilometers, you would get to know that COVID, what are the risk factors. So was it more in people who were traveling from abroad when we started the pandemic? So was it more and more in people who were coming from abroad? Was it more amongst people who were into air travel? Or was it causing more complications in the elderly? So if all this data can be incorporated, then public health authorities have a baseline to start from to incorporate and to bring in health regulations. Like the public health authorities had advised us to wear masks. We had this huge drive of vaccinating individuals, especially when we were talking about the third dose or the preventive dose in case of people who were at risk, like the healthcare workers. So all of that comes from the data that is available from various healthcare sources. The good thing about having the surveillance data from emergency is that it is much more timely than laboratory surveillance, because emergency data, you base it on the syndrome, so you base it on clinical features. So if you can have a standard format of recording the data of a patient, what is the presenting symptom, what is the provisional diagnosis or the provisional disease that the doctor is thinking about. Now, if you have all that data electronically in a particular server and you go about analyzing that data, you would know which disease is presenting at what point, which disease is causing more harm to the community. So we say there are several countries, the United States has something called the ED syndromic surveillance system, which they have brought into few jurisdictions, and they've seen that just the mere amount of, or the volume of data that is available helps healthcare authorities to find out if there is a particular disease that is happening more in a particular location of the community, or if there is a particular disease that is seasonal in nature, so there is an outbreak where there is an increase in the frequency of a particular condition. Like they had a cryptosporidium outbreak in Milwaukee, which somehow they could make out that this has happened because they could analyze the emergency department data from the hospitals in the locality. So I would, my take on this particular topic, where we are talking about disease surveillance in the emergency department, I would look or have a vision of a system where all our emergency departments are technologically advanced and we have electronic data systems where we can quickly send the electronic data that is collected in the various emergency departments to a central server, which can be timely people can look into it, find out what's going on, and this data can be quickly sent off to the health authorities to improve the general health of the community. Thank you.